Welcome to Health Oddity, the show that strips away the jargon and hype surrounding all things health and fitness to help you live a long, strong and energetic life. Lining up at the bar this week, here's Peter Lant and James St. Pierre.
Hello and welcome to the Health Oddity podcast, episode 227. Now, first of all, before we start, we have to say Happy New Year. So if you are listening on the day of release, which I know many of you do across the world, around the world even, we are on the 3rd of January. So we've just had Christmas, we've just had New Year. And I know that many of you, or many people in general, start the year, with positive thoughts, with thoughts of changing, with thoughts of maybe, turning over a new leaf, starting a new chapter, doing things slightly differently. And we are joined by a very, very special guest today, who I will introduce you to in a second. First of all, I will just touch base with my usual co-host, Mr. Peter Lant. How are you doing, Pete? You okay?
I'm doing very well. Happy New Year.
Happy New Year to you.
I would ask. No, I won't ask how your Christmas was. Not because I don't care. There's a reason for that. But
yeah.
Anyway,
yeah.
No, it's funny because we got a little insight before we started recording. Actually, before the guest came in, our esteemed guest for today came in, we got a little insight into how people think just by a simple Google. Because we're going to be talking about the spine a lot today and stuff like that. So James Googled about what did you go? What is the?
I think I Googled common reasons for sickness at work or something like that. Yeah.
And what came up first?
And the first thing that came up, that you get questions that come up that people will tap in. The first thing that came up was best excuses for going sick off of work or something. So
yeah,
it was
best excuses to tell your boss about why you're off work or something like that. It's like, right, okay, there we go. We've had a little look into the human psyche there.
Excellent. Before we start, I really must just quickly read. We have had a new review in on Apple Podcasts. So we do try and get reviews in on Apple Podcasts. If you leave us a review, we'll read it out online and we'll send you out some free merch, either a Health Oddity t-shirt, Health Oddity sweater, hoodie, something like that. And this one was specifically written around episode 219, which was the podcast we did with Steve Bush, where he was talking about his 5-year anniversary after his gastric surgery. And this was written by Ryan J80. And he said, as a fellow member of Unique Results and someone who trains occasionally with Steve, it was fascinating to learn about his journey from surgery to where he is at now physically. I had no idea. Superb episode, was totally engrossed. So thank you very much, Ryan. If you can message us, let us know which color hoodie, t-shirt, sweater you'd like, and which size. We'll get that shipped out to you, and send me your postal address as well. That would be great. So yeah, please do. Apple Podcasts, leave us reviews on there, and we will read them out online each time we get them. Fantastic. Right, now we are kicking off 2025 with a very special guest all the way from Michigan in the USA, and we are joined by Dr. Ryan Wohlfert. Hello, Ryan. How are you doing?
Great, James. Thanks for having me on. Hey, Peter.
Excellent.
Hello.
And Ryan is a health and wellness doctor. He's a doctor of chiropractic. And we are going to be talking about the spine, I suppose, but also about health in general and the body and movement and how we can feel good. We can move well. We can get the most out of life. We've got loads that we're going to talk about in terms of spinal strength, spinal hygiene, maybe nutrition as well. And we're going to we're not sure where we're going to go, because we've got this guest is given us so much information already that I'm kind of looking at. But one of his strap line, if you like, or is strong spine, active life. And he's talking about things like active living, longevity, that kind of thing. So I suppose to begin with, Ryan, what might be helpful we'll start from real ground level, and just sort of say really maybe, what is the spine? Why is it so important? Why is the spine so important from your point of view? And, what is a strong spine? What is a healthy spine? If we can kind of really start from that kind of basis, we can go from there.
Wow. Yeah, that's a good jumping off. That's a good jumping off point, because, the spine is probably it's very misunderstood. It's very, underused as a avenue for overall health. Like, again, we were talking before about back pain, right? And that's what we think. Okay, your spine is out of whack if you have back pain, or if you have back pain, your spine's out of whack. It's not in the right position. It's out of alignment, whatever. And that's the only way to know if there's something wrong with your spine, which that's not the case, because we can have no pain, but our spine is trash. It can show up in different ways. But I like to start off with this line: is especially heading into the new year, it's the spine, it's the foundation of our strength and our function in the body. What I mean by that is, so the spine, it's our strength. So it's got to be in a certain shape aligned with gravity. So just a real quick crash course: from the front, we want it straight up and down, right? We don't want it leaning off to the side. From the side, we want the head over the shoulders, over the hips. So if we're looking at our external posture, that's what you want to look at. We want those points lined up and then directly stacked over our ankles. Now, if we took x-rays of your spine, which I recommend, I'll tell you right off the bat, we need to see what it looks like from the inside. We want to see from the side these 3 equal curves. Now, what these curves do, they provide the strength and the absorption and the shock absorption of daily life. So we want like springiness. Okay, we want these curves to balance each other out. So that provides the strength, and also the muscles, right, attach to the bones of the spine. So muscles will pull in different ways. So if the spine is out of line, if your posture is poor, which I will say this, posture is a window to what your spine looks like, and also how your nervous system functions. And that's, we'll get to the function part of it too. But like, it's your strength. So if you are like hunched over, just like if you would take a weight, like 15-pound kettlebell or 20-pound kettlebell, which is about maybe the weight of your head, like 12 to 15 pounds, and we extended it away from our body, your body is going to be working harder. It's going to wear down faster. It's going to cause lower energy because it's going to wear down faster, using up resources just to hold that up. But if we would bring it closer, we could hold it for a lot longer period of time. Your body is in a stronger position. It's the same thing. If your head, you get that hunched over posture, it's putting tons of chronic stress and strain. Yes, it can lead to arthritis, pain, low energy because your body is just using so many resources. But what's interesting is research has also shown that this type of posture, a type of spinal distortion, is in about 70% of the adult population. Think about all the things that we're doing in this hunched over posture. And that posture there, that spinal position, that spinal abnormality, that increases the risk of heart disease, of death from heart disease, lung problems, and from all causes, which not many people know about. They think, okay, it's just pain, but it affects our overall health, like you said, James, because of the effect it has on our heart, our lungs, our immune system, our digestion, our metabolism. It's almost like this, I want to say low-hanging fruit, but if you get this part of it, then a lot of these other symptoms get better too. So that's why the spine is so important, and why we want to make sure we're addressing that, especially if we're in the new year, we're starting to go to the gym more. We want to be more active, because if our spine is not in the correct position, then we're going to get hurt or injured more than likely. We're going to get these aches and pains. Then we're going to stop working out. And that's where the nutrition comes in, which we'll talk about too. So that's, in a nutshell, why it's so important. But even above the strength part of it, it's the foundation of our function. And by function, I mean your nervous system function. All your brain tells your body what to do. All cells, tissues, and organs has got to send the signals down through the spinal cord, out through the nerves, to every single cell, tissue, and organ in your body, which includes your muscles, your joints, immune system, everything. So where is the spinal cord? It's inside the spine. So the spine protects the spinal cord and allows it to, when your spine is in the ideal position, again, straight from front to back, 3 equal curves from the side, one in the neck, one in the mid back, one in the low back. It's it allows the spinal cord to stay nice and relaxed. So think about a big fire hose, like a fire hose. All that communication and signals and energy from the brain can get down through the spinal cord and out to every single cell, tissue, and organ. But if it's, shifted side to side, if we're in this hunched over posture, well, now it's like it's turned down a little bit. That faucet is turned down. We get kinks in the hose, and you might be getting some water or some electricity or energy there to the end point, but it's struggling. It's maybe, again, it depends on how bad the dysfunction is, how bad the structural problem is, but you might be maybe 20% decreased, 50% decrease of that. And then this gets confusing for a lot of people is, well, I didn't feel any problems yesterday, so why do I feel it today? Well, a lot of times you don't feel there's a problem with your heart until you have a heart attack, when, again, we know the coronary arteries, they're plaquing up, they're getting atherosclerosis 80-90% occluded before you actually have a heart attack. So this is how the body works. I say it's the perfect design, because if we could feel every single little thing wrong with us, every stress that we put on our body, we wouldn't be able to function. We wouldn't be able to do anything. So our brain has this amazing ability to deal with that, but then it gets also confusing when we do get these symptoms. So that's, again, in a nutshell, why the spine is so important.
Yeah,
it's great, because we were talking. It might have even been before you came on, but it was certainly before we started recording. Because when we were talking about people being off work with back related issues and stuff, that can even go as far as, depression and anxiety and things like that from a back, because they can be a symptom, or they can be caused, or what would you call it? Anyway, they can be a symptom of like back pain, can't they? And then you become like, is it going to be like this forever? Am I going to be this person who has to put up with this? Am I going to have to take painkillers? And then your central nervous system just goes on overdrive, like we were saying. And I like what you said there, because if you knew everything that you said, all the fires it was putting out all the time, you'd be astounded, wouldn't you? Because it would just be like, it's just so much going on that you're not even aware of. So for you to become aware of something, it's like, right, this is a problem. What are you going to do about it? So that's where we'll get to, I suppose, because we were talking about people join the gym in the new year. They might go and start lifting stuff. They might hurt themselves by doing it. They might not. But people tend to think like there's an event which causes the problem. And in my head, it's kind of like, you might be doing some deadlifts in the gym or something, and that's okay. You might be doing them perfectly. But then you go to pick something up at home and you do a rotation, and that's when you're like, hang on, I'm super strong. It's like, yeah, but do you ever do rotation? So, I mean, we've got plenty of things that we were saying we were going to talk about, but like spinal hygiene pops out for me for the listener, because it's kind of like, that's what everybody can do, right? So, I mean, if you want to start with that.
Let's dive into that. And I like what you said there is, and it's not, so a couple things. One, like when we go to the gym and we start adding weight to our, structure, whether it's squats on the back or leg press or deadlifts or lunges. So it's like the example I gave where, okay, let's say you're in this hunched over posture, your head's forward, it's like 12 to 15 pounds at arm's length away from you. It increases the stress on the body, right? The muscles working, the joints working. So now think about it. If you're stuck at a computer day after day, or hunched over your phone day after day after day, or even just for 20, this is a key here, for as little as 20 to 30 minutes in that hunched over position, it starts to, I say, stick in that position, and it keeps going there. So now you go to the gym in that already stuck abnormal posture, and now you add weight to it. Well, it's just a recipe for, again, breaking down injury. And then the second point is, yes, so many people think it should be like a one-time event, especially with pain or your back going out. Whereas how I like to describe it is, it's not like you're lifting 1,000 pounds one time, but all these repetitive movements we're doing, it's like you're lifting 1 pound 1,000 times. It has the same effect, but it just takes a little bit longer to get there. And so that is something I try to impart on my patients and clients, is helping them understand that. So now going into the spinal hygiene, this is very similar to dental hygiene, or, for years and years and years, the ADA, the American Dental Association, brush your teeth, floss your teeth twice a day. So like this dental hygiene, and people do it. Well, we want people to do spinal hygiene. We want them to take care of their spine just a couple of minutes each day minimum, where I do this every morning, where I take my spine through all of its ranges of motion for like 2 minutes. So there's a good spinal hygiene exercise is, so you can do it sitting, kneeling, standing. I like doing it standing or kneeling down. Is what are the motions of the spine? So that includes neck, mid back, low back. We want to take them in all of their pain-free ranges of motion. So very simple. You just bend down to the side. You can do it like 10 reps to each side. You could do it, as you do it, you hold for 5 to 10 seconds each side. And I like to separate the head and the neck just to make sure I get that. You can combine them to where, okay, you're bending down to the side and you're taking your head and neck down that way too. So, lateral flexion, side bending. We do flexion and extension. I know we've already talked a lot about, okay, this hunched over posture that many people are in. So that doesn't mean we don't want to move in that direction. It just means we don't want to chronically be in that position. So same thing, we want to take the joints in that range of motion, but really obviously extending back, making sure we get the extension all the way back. So we got side bending, flexion, extension, then we have rotation. Like you said, Peter, we don't train that rotation. So it's just very simple, rotating side to side. Again, you can take your head and neck along with your trunk, or you can do it separately. You can even throughout the day doing it, but at least once a day, taking 10 reps, doing each of those, or again, holding, doing maybe less reps, holding for longer time. But one caveat, if you have osteoporosis, if you have, compression fractures, anything like that in the spine, you want to watch out for, again, excessive rotation or forced, or with any of these, you don't want to force it. It's nice and easy controlled movement. So that's a great spinal hygiene exercise or method that you can do just on a daily basis.
I'm just thinking that's almost with like habit forming and sort of atomic habits and that sort of thing. If you were to sort of stack that, you could almost stack that with brushing. You mentioned dental hygiene, didn't you? You could almost do some of that while you're brushing your teeth, couldn't you? Wouldn't actually, where you're kind of then using the same 2 minutes or 3 minutes that you. What are you thinking, Pete? What are you going to say? Pete's got a smile face. Sorry.
No. It's a bit jokey, but it's not as well, because the first thing came to my mind was like, right, what's the equivalent of the toothbrush for the back? Because we need to invent that now, and we'll make a fortune, right? Because everyone will need one. But what James has just said there made me think, because dental hygiene, people do it. It takes 2 minutes. You need a toothbrush and you need a sink and some toothpaste, and you need to stand there and do it and all of that. With this, you can do it anywhere. You can do it at any time of the day, anywhere. So you can do it while you're waiting for the train, while you're waiting for the bus, as soon as you get out of the car. You can stand up next to your desk and do it. Like you don't need a mirror and an implement and this and that. You just need to move, right? So it's accessible to everybody.
Right, exactly. And I like James's point of habit stacking. That's one of my favorite books is Atomic Habits. And a lot of it is you have to create the habit, or and then you can build on it. But yeah, we need some sort of cue, right? That's what he teaches. You need some sort of cue, and if that's it, awesome. I know there's friends and people who every time they go, and this goes into even the exercise part of it, the general exercise, where every time they go to the bathroom, they do 5 push-ups, where you could incorporate that as well. I like using timers a lot of times, especially when I'm doing work at the computer. If I'm writing an email, if I'm, whatever I'm doing there, creating a program for like 20 to 30 minutes. Because like I said, if you are stuck in one position for 20 to 30 minutes, then it can, and this gets even into the other part of the therapy that we do called traction. We use that to our benefit, where for 20 to 30 minutes, if you're in a certain position, it starts to reform the ligaments that are holding the spine together. And those are often missed. We talk about muscles. The muscles are a lot of times when you feel tightness in the muscles, It's because, okay, there's something wrong with the actual structure of the spine because they're just constantly active.
So is that
It's-
kind of like plasticity? Is that what it's like? You know, you can get neuroplasticity, don't you, where you form pathways
Yes.
neurally, but you get kind of that plasticity of the body where you say many people now are sat for 8 to 10 hours a day in front of a computer, you know, in flexion, you know, flexion at the hips, flexion at the knees, flexion, you know, spinal
Yeah.
flexion, everything. So yeah,
Yes.
it's really, so how many times would you recommend someone go through this? I mean, initially once is better than none, obviously. So that's the first thing. But is this something, this spinal hygiene, is this something that you can't really overdo? You can do it 2, 3, 4 times a day, and it's going to be
Yeah.
positive. Or, yeah. Yeah.
Again, it all depends on how much you are inactive too.
Mm.
If you're pretty active throughout the day, you might only need to do it once. If you're not, then I would say up, 3 to 4 times a day. You can't really overdo it because it's pain-free. You're taking it through a range of motion. It also depends on if you've had any injuries, if you have arthritis, if you have disc problems, because we've had people with that. So if you're listening and you have something like that, which even a lower level type exercise. So this would fall into like the exercise part of, and I'll just mention it now, like my Eaton protocol, EATN. So there's exercise, adjust your lifestyle, traction, and then nutrition. So falls into that exercise part of it. We want the general exercise, which you guys are great at with the gyms and working out, but we want the specific spinal exercises as well. So yeah, if you have, so a good low back, one of my favorite ab exercises, which I'd be shocked if you guys didn't already teach this just innately to your clients, is the abdominal brace, right? The abdominal hollow to help stabilize. There's sometimes that people are so flared up, so injured, which we'll talk about the nutrition part, but it hurts for them not only to move in that moment, but the next day it's a problem if they're in an active form of arthritis where the joints have broken down. So a great exercise to start on is just a simple abdominal brace exercise, because you can do it sitting, you can do it standing, you can do it driving, anywhere, where you're simply bringing your belly button towards your spine. But here are some keys. It's not sucking in and holding. It's not holding your breath. You want to be able to control these core muscles. And it's not necessarily like the six pack. It's the deeper ones, and they go all the way around to your low back. So with the low back, I'm sure you guys are familiar with weightlifting belts, right? This is our own built-in weightlifting belt. When you have pain, or if it's especially with low back pain, this muscle shuts off, or these muscles shut off. And what research has shown, which is amazing, like even before you move, as you even think about moving, these muscles contract. So, and they contract to help stabilize your spine. And if they're not working because the pain has shut them off, or they're shut off from being in a horrible posture and irritating the nerves, then we have to retrain them. So again, simple exercise. I like to explain it like, all right, so you got these bones on the front of your hips, you go right on the inside of those, and you feel it soft, but then you want to make these muscles hard. And if it's hard for you to do that, envision somebody's about to punch you in the stomach, right? So nobody has to, but all of a sudden you see that punch coming, these muscles just tighten up. It's not necessarily they go out, it's almost like they go in, that belly button goes towards the spine. And as you get better at it, you can squeeze harder and harder. Like I'm doing it right now and still can breathe and talk. And that's the point you want to get to. You don't want to hold your breath doing that. So that's a good starting point if you feel like even the spinal hygiene range of motion exercise is, if you did it once the day before, then all of a sudden, okay, that was too much. Stabilizing, working on that. And you can't do that one too often either. If you like having sets and reps, you do like 3 sets of 10, 3 times a day. If you want to have that in mind, where you're holding for 5 to 10 seconds for that.
It's great this because I do this all the time. I mean, I do it when I'm on the podcast. I'm sitting doing this while we're chatting away because I'm sitting down. But it's really interesting because we talk a lot about on here. Like, if you go for a walk one day, you can go for a walk the next day. You can probably go for a walk the next day. You can go for a walk the next day. You don't suddenly forget how to walk. If you sit down a lot, that can start to happen, right? But so with this, if you're like, one day you're here and you do this with your head and it goes that far, and then the next day, and then the next day, and then the more you do it, the more range of motion you'll get and all that sort of stuff. So what it does tell you for me is, so using myself as an example, I've been sitting at my laptop quite a lot over the last few weeks because I've had something to do that involved me having to do that. I used to do that for a living, but I don't anymore. But I hated it and I felt I was getting tighter. And when I was doing movement, I felt it was tighter. So what's good about it is it tells you what you did in the last day or so, if it's had an effect. So if you start moving and then you can move less, you'll be like, hang on, something's different here. What have I done differently? Or what have I done to cause that? And then it kind of feeds through, doesn't it? And then teaches you to, like, this is bad. This is, well, not bad, but this doesn't help with my mobility and this does. And then you can kind of, if it makes you feel better as well, then why wouldn't you want to do it? That's the way I see it.
It's interesting, Ryan. I was going to say, there's one of the things, because we spoke a few weeks ago, Pete, didn't we, about the way that if you stop doing, you kind of similar to what you mentioned, but if you never jump or you never sprint or if you never do things, you lose the ability to do it because you use it or lose it, basically. And I was in Iceland a couple of weeks ago and I was driving a big, like a minibus, and it was a bit of an old one. And I'm used to driving now in my car when I reverse, like most people probably now, you have like the rear camera that comes up on the dashboard. And so you actually don't ever need to do this, do you? When you're driving, you never need to turn your head because you just look at the camera in front of you and you might glance at the side mirrors, but you don't ever really turn around. And then I'm driving this big bus with no camera in front. So I'm really having to, turn around and look. And it's amazing how like you say, the body adapts, doesn't it, to what that plasticity, that setting yourself into what you're used to doing. So, I mean, do you find with what you do, the people you work with, that you get a lot more common postural issues nowadays because of the work environment people are in, like I mentioned, the driving environment, the general change of lifestyle? I mean, is that something that you've noticed a big difference in?
Absolutely. That's a great analogy right there too. Like your body adapts. Your body is a master of compensation. It will find the path of least resistance. It always will. And that's, again, another why change is so difficult and creating new habits is so difficult, because the brain even if it's not good for it, your body, the brain's like, I'm used to this. I don't have to waste a lot of energy learning something new. But in our day and age, with, again, the society that we live in, with the technology that we have, I'm not going to get rid of my computer and my cell phone, but I'm going to learn how to use it in a healthier way and help teach people how to do that. And where we're seeing this a lot with is, what population would you think we're seeing a lot of postural problems that we never did before?
Children and teenagers. Yes. Yeah.
Exactly. And we're seeing spines like that, maybe on them where they're in their teenage, early 20s, where we didn't see until they were like 40 or 50 years old, because of the positions that they're in. And, obviously with teenagers, what's interesting, I love this because I know I'm going all over the place, but Peter, you mentioned about anxiety and depression and just like self-esteem a while back. And if you've ever read or seen Jordan Peterson's book, The 12 Rules for Life, the number one rule, stand tall. Because of how it affects your self-esteem and self-confidence. So in an extreme case, we think about scoliosis, and scoliosis is a lot with kids, or more common in kids, where, again, they have low self-esteem because their spine is, they just look, different, or they feel like they're different. It's the same thing now, where if they're in this hunched over hyperkyphotic, that's what we call it, kyphosis position, well, now that is affecting their their chemistry of their body. It's affecting obviously the mechanics of their body and also the neurology of their body. So that by itself, yes, physically it's hurting them, but also mentally. They're not as sharp. They're not getting the blood flow throughout the body, which again, that's been shown too. When you lose the neck curve here, that normal banana shape, kind of position, or the shape of the neck, it decreases the blood flow to the brain. And by correcting that, it helps restore the blood flow. So yes, I mean, we're seeing these a lot more, and it's just different, right? It's not I live in Michigan, so it snows here. I just was out shoveling snow this morning before getting on here. And we do a lot of these things, or we try to do active things that we had done in the past where it wasn't really a problem, but now we do it and where our body is not in a position where now it wears down because we haven't trained it to keep it in that position. So, and that's what like this whole Eaton method is for, is, as a chiropractor, we're known for, giving adjustments, right? With our hands, a pop, crack manipulation, right? Well, that's awesome. It's great for getting the joints moving again. It's great for like giving a supercharge to the nerves and the nervous system, getting the nervous system functioning again. But just like working out one time, just like, and I'll use another teeth example, mouth example, oral health example. There's a difference between going to a dentist and an orthodontist, right? So you brush your teeth, you get cleaned, that's part of like being in the dentistry, doing oral health that way. But if you want to correct the structure of your teeth, you need braces. You need the orthodontist to put those on there. And that's the difference with what we do and what the like Eaton method is, because it combines the exercises to help strengthen the muscles. It combines the adjusting your lifestyle, I call it. So adjustment, if you're in front of me, okay, the spinal adjustment. But if I'm working with somebody remotely, which I do virtually, I can't, use my hands to adjust them. So we help to adjust their lifestyle, making sure that they're holding their phone correctly, they're sitting correctly, they're bending correctly, go through training with that. And then, the secret sauce, which I don't want it to be a secret, is the traction part, the T, because the traction of the spine is like the braces on the teeth for the teeth. We have to hold the spine in a certain position for a period of time for the ligaments to reform. I mentioned that 20 to 30 minute mark, where if we're distorted for 20 to 30 minutes, it starts going in that direction and staying there. Well, now we'll use that same principle going in the opposite direction. So a simple thing, we grab, this little tool here, a towel. Using towels, and there's specialized spinal remolding blocks to help do the traction. Like in office, there's other machines that we use to help hold it there. And you might be thinking, okay, it's this like decompression, right? That's a form of traction. That's not a corrective form of traction that helps with the symptom. But for correction, we have to look at your spine. All right. It's very simple. I like simple. If it's hunched over, all right, well, now we have to say, all right, well, what's the opposite of that? Well, now we have to put it in the opposite position. Maybe this goes in your mid back. Maybe this goes on, the bottom of your neck, and you lay down on this, working up to 20 to 30 minutes a day to help reset your ligaments, to help reset your brain and what normal is. So that's, the traction part of it. Obviously, we can be more aggressive with it and hold it there for, because towels have, a limit on what you can do with these. But the other methods where it's more personalized, this is a more general, where personalized, we could look at your spine, look at your x-rays and say, okay, these are the types of traction modalities for you to use. So that the traction is so important to help hold the spine there, just like braces do on teeth. It's got to stay there for a certain period of time.
This is one of the problems, isn't it? And when you got in touch about doing this, you'd been listening to I've forgotten his name, Aiden,
yeah.
O'Flaherty. O'Flaherty, that's him, yeah. And you said about that, it's like there's not a one-shot deal for this sort of stuff, because people say, I've got a sore back, what can I do? And it's like, I don't know, do I? But what you've just said there about like anxiety and stuff is really interesting, because like the stand tall thing, because on the mental side of it, you know, it's like if you start talking, like, because I just thought about it as you were talking there. I've started to be aware of my back and going like, oh, right, okay, what's it do? What's it do? It's like you talk about nits and everyone gets an itchy head, right? Except James. But people do, right? You talk about nits, you get an itchy head. You talk about having a sore back, or you talk about the spine, and people start to become aware of what's going on. So then if it's self-fulfilling, I suppose, isn't it? If you've got pain in there, then you're constantly thinking about it. And if you're telling everybody about it all the time, it's like, well, you're creating that. And you said about that book, there's a Peanuts cartoon, I think, where Charlie Brown's like standing like this, and they come along and say, are you okay? And he's like, no, I'm in a mood, and I'm going to stand like this. I'm depressed. And they've said, well, what you need to do is like stand up tall and back. And he goes, no, because if I do that, I'll be in a better mood and I want to be depressed. So I need to stand in this. So but that's what people do, don't they? And Stuart
I
McGill,
gotta find that one.
yeah, I'll send it to you. I've probably got a photo of it somewhere, but Stuart McGill talked about this, and he said people will come in to see him and sit in their pain. Like they'll say, oh, it hurts when I do this. And he's like, well, don't, you know, and then they do it. And that's how they sit, because they want to feel, yep, it's still there. It's still there. So, you know, it's one of those things that's hard to get across, because people say, well, what do I do? And you've got this protocol.
Yep. Well,
but,
and you know, people want that one thing, right? They probably ask you guys too, what's the one exercise I can do?
Yeah.
And I mean, I'm glad you mentioned Stuart McGill, because he's got the big three exercises for your spine. You know, the cat cow, all right, which is again like the spinal range of motion exercise, the hygiene. There's the bird dog exercise, right? And then there's also the curl up, which is, again, it takes the stress off the spot, like off the low back, because, you know, sit-ups, crunches. What are sit-ups and crunches? It's that flexed position that we're always in. Not that you shouldn't do them, but if you already have problems with your back, you want to decrease the amount of stress you're placing on it. And when you lose the curve of the low back, which we do when you sit, it's been shown, you lose about almost 50% of the curve. So now if you're sitting there for 20, 30 minutes, hours, it's staying in that position, and it's putting your spine in a horrible position. You go to the gym, you start to lift, crap, I hurt myself. Now I can't do anything, right? So that leads into the nutrition part of it, which we'll talk about. But I mean, that's a great point there, Peter, where it's a self-fulfilling type thing. And it's a practice. That's why I call it healthy living practices. We practice these things. It's not a quick thing. And one of my least favorite expressions is quick fix, because it gives the impression that it gets fixed, which, you know, I think most people know that it doesn't happen, especially with the body. Yes, we want to pray and hopefully we get a miracle and we're fixed, but most of the time we have to do like a simple and consistent activity over and over again to get the results that we want.
I really love this, because I think it seems to me that many therapists, you know, we talk to sort of physiotherapists, osteopaths, chiropractors, that kind of thing, are moving away from just this hands-on manipulation. Come and see me once a week, once a fortnight, once a month, and we just click, and then you go. Because like the whole protocol that you're talking about, the Eaton protocol that we're going to talk about more about, you're really kind of empowering the individual, and giving responsibility to the individual to go away and do all this stuff, not just to rely on you, so that, like you say, that you're going to fix them, because they come and see you for maybe 20 minutes, half an hour, and you're going to fix them. You know, it's what they do when they're not with you. And it's the same that I say to people who come to the gym. You know, if you come to the gym, you know, an hour a day for say 4 days a week, you know, 160 odd hours, you're not at the gym. What you do outside is far more important than what you do in these couple of hours that we're together. It's the whole lifestyle piece. So maybe we can touch on, because I never really thought before about about nutrition in terms of how it might relate to the spine and spinal health. I don't know if maybe you can talk about that, because that's something that I've not really heard anyone else talk about before.
Well, and that's, I'm glad we're talking about it, because that's probably a lot of your listeners, a lot of your audience is maybe in that same boat. I mean, the spine's just like, is very similar to, again, all the other joints and the muscles, right? We need to nourish them. We have to give it the raw materials in order to use to either build it up, or if we're not eating the right foods or drinking enough water, or not giving it the raw materials, it's going to create what it has to work with, right? So if we're not giving it, the good foods, the anti-inflammatory foods, then the discs aren't going to stay hydrated, right? So you have the spine, which is bone. We have cartilage and ligaments, all right, where it's holding it together like that. Right between the spine, is the intervertebral disc, it's called. So it's this like fibrocartilaginous structure that separates between the bones. And with arthritis, with wear and tear, with again, I know, Peter, we talked about this. One of my least favorite other expressions is, it's because I'm getting old, right? I'm getting old. That's why my body's breaking down, when it's in fact not the case. It's the postures that we're in, it's the activities that we're doing, the past injuries that we've had that causes increased wear and tear. Well, now these discs start breaking down. And then if you add on top of that, the nutrition is not going into your body to help restore those, the disc is going to continue breaking down. It's the ligaments aren't going to, the bones are going to break down, and guess what? Osteoporosis. So, and this is one of the reasons I created, it's called my strong spine nutrition playbook. So people know what to do. Okay. And they get confused because there's all this other, stuff out there. It gets overwhelming, maybe not even confusing, it just gets overwhelming. So I just wanted to give them like a done for you. This is what you do. Here's a meal plan. Here's, here's again, some education to go along with it. But nutrition provides the raw materials. We talked about that. First, we want to make sure we're drinking water, right? Good, clean water. I like distilled water and adding some trace minerals back into it, but good filtered water, reverse osmosis, that's fine. Maybe adding some sea salt. All right. I like adding sea salt into mine because it helps just to absorb the water better. It's more hydrating. And the discs of your spine are about 70% water. So if they're getting dehydrated, oh boy, it's again, and now you're in a poor posture. There's more stress on your body because of just mentally, physical, chemical, emotional stress that are being placed on our body and our spine. So it breaks down even more. So water is key. Now, if we're looking at nutrition, so I'm a huge fan of finding out, how is the food you're eating affecting you? How are the common inflammatory foods that we eat in this processed food world affecting you? So I like taking people through what I call it, get real with your food. And it's based off of the Whole30 program, which again, I did, 10 years ago, and it changed my life. I've always been pretty healthy, but I worked out, but I look back to college years and all the food I used to eat there. It just, how things have changed. And I went through this Whole30, like, holy cow, like this like water weight, I call it, where just like this, not bloating, but just like the puffiness went away. I was just retaining like so much water. It didn't look like it because I've always been, somewhat thin. But when I did that, people were like, man, you're skinny. You're getting skinny. Are you sick? It's like, nope, I'm just getting, it's a healthy thing. So basically finding out, okay, in just in a nutshell, what it is for 30 days, you cut out, and I know it sounds extreme, and if people aren't ready for it, they might don't do it. But you cut out sugars, you cut out all types of grains, you cut out dairy, you cut out legumes, so like beans and peanuts, you cut out soy. Those are the main ones that you cut out. So essentially processed food. You want to eat whole foods for 30 days. And again, that can sound intimidating. That's why I created this. Be like, all right, here is the list. Here is the meal plan. Here's how you do it. And I did this because so many patients would come in, and even just like New Year was my like inspiration for it. or other patients coming in and saying, you know what, it hurts to move. It hurts to work out. Or again, they start going to the gym and start working out, and then they hurt themselves and they don't have their nutrition to fall back on. So one, I want it to use as a safeguard for that. But then if you do get injured, if you do get flare-ups, then, okay, what nutrition protocols can you have? So a little bit less aggressive, I guess. I don't even like the word aggressive because you think it's, this is just the way we should be eating. But if you wanted to do just more anti-inflammatory without like the 30-day strict, okay, not eating these foods. So let me finish up with the get real with your food discovery plan. So like the 30 days. So after that 30 days, it's not like you can't ever eat these foods again. What you do is you find out how is my body reacting to dairy, to wheat and grains, to soy, to sugar. So you slowly introduce them back in. And here's how you do it. Like the reintroduction is, so you go through 30 days, then day one, I'm going to introduce a little bit of dairy into my diet. So like I'll have a little glass of milk. I'll have a little bit of yogurt. I'll have a little bit of cheese. Not a ton. Don't overload your body with it, because now your body is cleaned out from all that crap. So now you reintroduce that one, and then you wait for a couple of days to see what your response is. What type of symptoms do you maybe get? My wife, she went through this too, which she's a chiropractor as well. She went through this too, where she'd have problems with bloating, where like she'd have, and we found out through this, it was dairy was her big inflammatory food, where again, she would say like she was 4 months pregnant, like her gut would just she had ice cream or milk or cheese. She cut that out. We reintroduced it. Now, 10 years later, she can have, and I can have, we can all have it. We just have to deal with the consequences. A little bit of ice cream, not a big, vat of ice cream, but it's those types of things to find out how your body is reacting to these foods. Another way to do this is just more anti-inflammatory. So if you do have a flare-up, for example, go into like a pretty anti-inflammatory food meal plan, if you will. Like it's a plug-in, I call it. You can plug it in anytime, where you're eating lean proteins. You want to eat all these, and one caveat, eat as organic as possible with no pesticides, no herbicides. Eat as organic as possible. I know sometimes that can be tough. No hormones in your meats, but meats, vegetables, fruits, again, they're all acceptable. But you just, again, it's like going back to, you just got to do it, right? It's like going to the gym.
It's interesting, isn't it? Because it's kind of like it's an essentially, it's like an elimination diet, isn't it?
Yeah.
Where
exactly.
And then when you gradually reintroduce, because most people all the time just eat so much of everything, you've got no idea what's having an impact, have you? It's like if you're exercising and you're going into the gym and you're doing 20 different exercises, and something is you're getting a sore knee, but you're doing 20 different exercises and you haven't got a clue what. So you've almost got to strip things right back and say, right, let's look at, because you don't know the culprit, do you, when you're throwing so much stuff at once? So, and we've spoke about this before, Pete, haven't we? That most people don't actually know what it feels like to feel really good. So most of the time they're feeling pretty average to ropey, and that's the technical term. They're feeling average to ropey. So actually, I've got no idea. Well, if I took this out, would I feel better? Or no, it's a sensible approach, but I know what you mean. In today's society, that sounds quite, like you said, extreme, or but that's just because we're so far away from natural, eating, if you like. What are you going to say, Pete? Sorry.
I know a couple of people who've been to the doctor, because they have whatever flare-ups or a skin condition or whatever it is, or low mood or something, and they kind of think I think it's something I'm eating. So they go to the doctor about it and say, can you do like, the scratch tests that they do and all this, or like any, what's that called? Allergies or whatever. And I know someone who's been to do that, and the doctor's like, well, not really. And they're like, but you're a doctor, you should help. And it's like, I don't like, what do you eat on a daily basis? And if they can't tell you, or it's like Pringles and this and that, it's like, right. And like James, what James has just said, people think it's like, you said it yourself, Ryan, is this might seem a bit extreme. And you use the word protocols, right? Which I'm not saying there's anything bad with that, but having to call it that is like, no, it's just eating, isn't it? It's just eating a sensible diet. Like, you know what I mean? But these are the words we'll have to start using, like in a clinical kind of way, almost. When it's actually just eating the food of the land. So I think it's amazing because people think that is extreme. It's like, no, it's 30 days out of your life. People will do dry January. Do you have that in the States when people don't drink for January because they've had so much over Christmas and what have you?
Yeah.
Like if you can do that, you can do this. And then like you say, you find out a hell of a lot of things. A hell of a lot.
It's being prepared too. I mean, this is, I know people are hearing this January 3rd. In January, I would say don't start at January 4th. Prepare. You need to prepare for it. It's making sure again, doing some research. And again, Peter, you and I are both familiar with Brian Grasso. He talks about, intellectualizing it and then experientializing it and then ritualizing it. So again, I know for me, the more I learn about a topic or a workout program, the more I want to do it. And it's not like sometimes I don't just jump right into it, or a lot of times I don't jump right into it. It's like, okay, I read about it. Like, okay, yeah, that's cool. I write down my plan and then get into it. And then guess what? As I experience it, I start to adapt it. And this is kind of like what nutrition is. It's finding out in the beginning, okay, giving it a good, honest try, 30 days, keeping track of how you are feeling, counting, like as you're going through it, seeing how, all right, how good are you feeling? I know for me, I always struggled with headaches and migraines. And as I was going through this, headaches went away, migraines went away. They'd already, subsided substantially from when I was in the 8th grade, when I first started getting them, because I was working on my spine since that point. But this was just like that extra step, that not even extra step, that just unbelievable step, adding the nutrition, because like Jim, like how you said, is not many people understand how nutrition is so important for the spine, in pain in general, and how your body feels, which is amazing to me, right? It's amazing to all us, like nutrition. You don't think what goes into your body has an effect on how you feel. And when you talk about it, yes, they start to understand it. And if they push back on the whole food thing, like how is that going to help my spine? How is that going to help? Like if they have pain? Well, I say, do you ever take ibuprofen or medications? Well, yeah. Why? I mean, it's essentially a chemical messenger, right? That pill that you're taking to help your body feel better. Food's the same thing. It's just doesn't have the side effects that all these other things do, and it's not going to break down the rest of your body, stealing from Peter to pay Paul, that type of thing. So just helping to these familiar concepts where like, oh, okay, I see.
There's an easy way to explain this, and it's just go out and drink a load of beer and see how you feel tomorrow. Right?
Yeah.
Food's the same, right? People don't kind of think of the food, the solid food aspect being the same. And it's like, yeah, but if you eat a load of this, you're going to feel like this tomorrow. Yeah. It's that simple, isn't it?
Yeah. Mm-hmm. In terms of, I'll tell you what, Rugs, we'll touch on something else, and then I think we're going to have to try and speak to you again, because this is we're just touching the surface of some of this stuff, but it's a fascinating, it's a fascinating topic for sure. The first topic that you'd mentioned to us, this unlock spinal strength for active living, and so do you see? I suppose this question, do you actually strengthen how would you unlock spinal strength? That's an easier question. Let me try and give you a load of options. That's just have an open topic.
So when I say spinal strength, what that means is what we talked about right at the beginning, is building that strong structure. All right. Where it's from the outside, your body's aligned with gravity. That's what a strong spine is. Your body's aligned with gravity, can withstand the forces and the stresses that are placed on it. So strengthening your spine is actually using the eating protocol, exercising it, adjusting your lifestyle to make sure we're taking the stress off of it on a daily basis, using traction to remold the spine with the curves in the right position and then straight up and down, and then using nutrition to help build it back up. So that's actually what building unlocking spinal strength. So I know, and some patients have even talked about that too, is like, my spine's pretty strong. I can lift a bunch of weights. Yes, it's not about the amount of weight that you can lift, or if you got 500 pounds on your back. It's actually looking at the spine to make sure it's in the right position. And the ideal way to do that is standing spinal x-rays. So again, x-rays aren't something to be afraid about. Okay. I'm going to be doing a video like dispelling these myths about, oh man, the radiation is killing you, and that the benefits far outweigh the risks of that. But yes, that's what building a strong spine is, or strengthening the spine is, making sure it has those 3 equal curves and your body and your spine is aligned with gravity.
And can you actually build more density in the bones of the spine? Like that? I mean, what's your view on as a chiropractor, as a doctor? What's your view on strength training? Like, if done correctly, in terms of you mentioned deadlifts, and things like that. I mean, obviously done sensibly, not done to extreme, done with good technique. I mean, are you a proponent of strength training?
Oh, heck yes.
Yeah.
Oh man, I do it 4 or 5 times a week. A huge fan of it. And especially because it helps to increase the density of the bone by putting load on it, right? So doing weight bearing type exercises, different types of squats, lunges. I love deadlifts. Deadlifts is one of my favorite exercises, as long as people are doing it for like the hips. It's not a back exercise, but it's a hip and leg exercise to take stress off of the spine. We shouldn't be lifting hundreds of pounds using our spine. Just like we tell people, like, when you lift up a box, okay, bend your knees, bend your hips, use your legs. It's the same thing when you're lifting weights, especially with doing squats, doing deadlifts, doing lunges. They have their place, and I love it.
Excellent. No, so just wondering, because I know some people, different thoughts around it, I suppose. But
Yeah.
and do you see the role of the external musculature of the body? So we've spoke about the spine, the spinal column, the central nervous system running through the spine. So the muscles that are on your body, they can obviously either help to improve and to keep your spine in a good posture, or they can, if done incorrectly or done without balance, they can, I presume, move the structure of the skeleton in a way that's not so advantageous. So if all you ever do is say bench press and chest fly and pec decks, and you kind of encourage this flexion position, which then is going to kind of stop you breathing as well, and using your diaphragm, and stop you standing upright. So I suppose, like anything, like any medicine or any food, it's the dose is the poison, isn't it? Too much of something or done wrong is not good. Yeah.
I love that analogy. Yes, I'm gonna have to steal that one. The dose. Yeah, I like that. Right.
Copyrighted now, James.
What I find is, especially as it relates to the spine and posture, is the spine gets out of position first, whether it's through injuries or gradually, and then the muscles react to that and basically stabilize it in that position. So we didn't talk much about like different type of postures other than like that hunched over posture, because that's the major one that we're seeing. But you could like strain your neck, and then all of a sudden your head starts shifting this way to help get away from the pain. So if you can see my head here, it's shifted to the side. And one of the brain's goals is to keep the eyes level. So you're not going to be like this, right, for long. It's going to tip it back the other way. So now that's off center. Now look what happens to the muscles on the side. Okay, one side is tense, the other side is chronically strained. So I find that quite a bit, especially with the spine. Now, like hamstrings, calves, quads, lats, those types of, but even those can be related to imbalances of not just your spine, but your entire, your body structure. because it's creating excess stress and strain over time. And then you go to lift weights, you go to, run, and all of a sudden now it goes, it strains. But just like how you said, anything that we do excessively and chronically is going to lead you in that position because your body's going to compensate to that.
Yeah, this is fantastic, Pete. And I think we'll start to wrap up, Ryan. But this has been, like I say, we could go on for ages. This is great. But do you want to maybe, you mentioned when you sent us some stuff through for like a gift for people who are listening, that we can maybe hopefully we can put this link in with when it goes out, Pete, or we can say where people have to go. But I suppose first of all, Ryan, if people wanted to follow you on social media and kind of follow more of what you do, I mean, are you active online? Is there somewhere that people can go to see your content and things like that?
I would say YouTube is the best spot, Ryan Wohlfert. But then I would say go to my website, drwohlfert.com, and I can supply you guys with all these links. And sign up for you can download this spinal hygiene mini class, and get on I send out a daily-ish type email and talk about healthy living practices. It's a lot about the spine, but then also about nutrition, mindset, those types of things too. So definitely do that. I call it like an inspirational type message. It's not just, just regurgitating everything, but just getting you in the mindset of healthy living and giving examples. And I even go into my life and how I apply it to my life. So that's a great way to do it. I'm putting out more videos on my YouTube channel on how to do things, how to take care of your spine. And I also have a gift it's my posture retraining mini course, which is different than the spinal hygiene mini class. So the mini course, the retraining, it's different modules, and I show you how to assess your spine, and I show you like different exercises based on what you find with your spine, how you can assess or what exercises to do for that.
Excellent. So we can, if you can let Pete have those links, we'll share. That sounds fantastic. No, this has been really a great episode to kick off the new year, don't you think, Pete?
I think it's brilliant because people hopefully will be more receptive to something like this at this time of year. They'll be like, oh, what is it? Like, this all sounds great. And they'll be like, right, I've got my New Year's resolutions all set up and everything. And one of them is going to be to sort my spine out. So, and then they'll get on for 30 days.
It's foundational, isn't it? Because most people I work with are in their 50s, their 60s, their 70s. And at that stage, and I'm in my late 40s, and by that stage, most people have had some kind of lower back issue in their life. They've either hurt it, or they may have chronic lower back pain, or they're careful of it, or they're wary of it. So and like you say, it's not just, well, you're getting old, it's inevitable. There's so much more that we can do. So hopefully, I mean, this has been one of those podcasts, I think, that applies to everybody, because everybody listening has got a spine, and I think and everybody is going to benefit from some of the stuff that you said, which is great. And we'd love to have you back on, Ryan. It would be, because that's been just touching the surface really of what we can talk about. But no, that's brilliant.
No, this is fun. I appreciate you having me.
Yeah, perfect. So if people just go onto YouTube and search for Dr. Ryan Wohlfert, they'll find you on there. And then
I'll give you the link to that too. So
yeah, we'll put links and everything in. Brilliant. Well, thank you so much, everybody, for listening. I mean, that's been brilliant. That's the first episode of 2025. That's episode 227. The next couple of weeks, we've got Paul McElroy back on next week, from Belfast, talking about his new book, Perpetual Strength. And then the week after, episode 229, we're going to be joined again by Nick Rainbird, talking about the latest. He's just been out in Poland, finishing off his Wim Hof certification out there. So we're going to talk about that. So we've got a couple of good guests coming up, following on from Ryan, who's kicked off the year absolutely brilliantly. So please do like, share, subscribe, leave a review if you're watching or listening on a platform that allows you to do so, especially Apple Podcasts. And then, like I said, I think it's Ryan, Jay, 80. If you can get in touch with us and tell us if you'd like a hoodie, a sweatshirt, or a t-shirt, we'll get that sent out to you as well. So thank you so much, guys. Thank you for listening again. Happy New Year, and let's make 2025 fantastic, and let's all be a bit more mindful of our spines and take into account what Dr. Ryan Wohlfert has shared with us today. Thank you so much, Ryan.
Thank you for having me.
Brilliant. Thank you, Pete, and we'll see you next week. Bye-bye.
You've been listening to Health Odyssey with Peter Lant and James St. Pierre. To get your regular fix of hype-free health, you can subscribe and leave a review wherever you get your favorite podcasts. You can find out more on today's and other topics at healthodyssey.com or find us on Facebook or Instagram by searching for Health Odyssey.